Besides being located in the same building, the Environmental Public Health Tracking Program and the Bureau of Immunization have a lot more in common than you might think. The development of the AIR and CVD dashboard, the cardiovascular disease dashboard, was a project that the Environmental Public Health Tracking Program, the national program, and its partners saw was an area of interest specific to the state of Iowa as well.
We were able to learn about the tool at department trainings. They presented dashboard training and demonstrated the air quality and CVD dashboard. So we were able to go ahead and look at that dashboard and see how we could relate that to our program.
This tool really allows us to begin to take a couple of different data sets and begin to overlap those data sets and show some comparisons between one set of data versus the other. And in this case for us it was air data versus cardiovascular disease and heart attacks, and begin to really understand what's the relationship between what's happening with air quality and what's happening with health outcomes. The folks in the Immunization Bureau reached out and said, well, wait a minute, this looks like this is something that we could perhaps use in our program. So that led into just a communication between the Immunization Bureau and our Environmental Public Health Tracking Program in the Environmental Health Services Bureau to say, hey, could we work together on this?
The tracking tool allowed us to represent human papillomavirus vaccine coverage levels for our healthcare providers. We had considered sending out large-scale data to all healthcare providers, so it wouldn't be clinic-specific. The tool allowed us to send clinic-specific immunization coverage levels for human papillomavirus. The tracking program has allowed us to streamline our data and to represent it in a way which we could not before. So this project has really allowed us to send data more frequently, provide more timely data to our healthcare providers, which hopefully in the long term will impact our immunization rates for all healthcare providers. We conducted a data analysis and we estimated approximately $15,000 could be saved with this project.
So much of what we do in public health relies on good, sound data. The thing that we're excited about with this dashboard is that it begins to allow us to have a more efficient use of that data, a more efficient use of staff time, and we can begin to pull data sets together to establish some of those understandings about what may be going on here between the environmental exposures that are out there and the health outcomes that we have, and really begin to cause us to take a step back and look at what are those relationships and what are the things that we need to put towards those understandings in terms of research efforts, resources to address policy issues that may be of concern, or other uses of data that we haven't yet thought about.